For decades, it's been a staple in a lot of medicine cabinets, right? That daily low-dose aspirin, seen as this super simple way to protect your heart. But what if I told you that for millions of people, that advice is completely outdated? Let's get into it and find out why.
So here's the big question we're really tackling today. Is that daily baby aspirin habit still a good idea for you? You know, the answer has gotten a whole lot more complicated, and it is so important to understand what's changed.
Because here's the bottom line. For millions, and I mean millions, of older adults, the expert medical advice has done a total 180. What used to be a pretty standard recommendation is now a really personal calculation of risk versus reward.
Now, to really get what's going on, we have to get super clear on one critical distinction. It all comes down to these two terms: primary versus secondary prevention. And trust me, which one of these categories you fall into, well, it changes everything.
Okay, first up is primary prevention. The easiest way to remember this is to think of primary as in first. This is all about using aspirin to prevent a first heart attack or stroke. And the key thing here is that this is for people who have no known history of heart disease. None.
And then, on the other side of the coin, you've got secondary prevention. This is for folks who have already had a cardiovascular event, like a heart attack. They're taking aspirin to prevent another one. The whole goal is to stop a second or a third event from happening.
So let's just put them side by side so it's crystal clear. Primary prevention, you've got no known heart disease. Secondary prevention, you do have a history. You've had a heart attack, a stroke. Maybe you've been diagnosed with coronary artery disease. This right here is the fork in the road where all the new advice splits off. And this is where the major changes have happened. So let's break down the new rules for that primary prevention group. Those are the people with no prior history of heart problems.
For this group, the guidance is now incredibly clear. If you're 60 or older and you do not have heart disease, the U.S. Preventive Services Task Force, they're a big deal, a key panel of experts, they now recommend against starting aspirin. So why the big change? Well, it turns out that as we get older, the risk of serious internal bleeding from aspirin starts to outweigh the potential benefit to your heart.
Okay, but what if you're between 40 and 59? Well, it's not a simple yes or no anymore. It's really about having a careful conversation with your doctor. And starting aspirin should only even be considered if you check these 3 boxes. Your 10-year risk of heart disease is high, your personal risk of bleeding is low. And, this is key, it's a shared decision you make together. Let's just zero in on that risk number for a second. Your doctor uses a special calculator to figure out your odds of having a heart attack or stroke in the next decade. For this whole conversation about aspirin to even get started, that risk score has to be over 10%. That's the magic number, the threshold. And what if you're someone who's already taking aspirin for primary prevention? The new guidelines suggest that this is the perfect time to talk to your doctor about whether it's safe to stop, especially as you get close to age 75. That's when that bleeding risk really starts to creep up. But, and this is a really important but, this advice does not apply to everybody. Okay, I really want to pause here and be extremely clear about something. All those changes we just talked about, they are only for primary prevention. There's a whole group of people out there for whom daily aspirin isn't just a good idea, it is absolutely essential. So let's talk about who that is right now.
So here's the critical point. If you are in that secondary prevention group, meaning you've already had a heart attack, an ischemic stroke, or you have known coronary artery disease from something like a stent or bypass surgery, these new guidelines do not apply to you at all. For you, daily aspirin is still a lifelong standard of care recommendation. Please do not stop taking it without talking to your cardiologist. So, how in the world do you and your doctor figure all this out? It really helps to think of it like an old-school balance scale. On one side, you've got the benefits of preventing a clot, and on the other, you've got the very real risk of bleeding.
And this is kind of how that balance looks in real life. Things like having known heart disease or a previous stroke, that puts a lot of weight on the side favoring aspirin. But other factors, like being over 75, having a history of ulcers, or taking other blood thinners, well, they tip the scale sharply over to the avoidance side. It all comes down to your personal health profile and which way your scale tips. Look, all this information isn't so you can make this decision all by yourself. It's to empower you. So let's talk about the next logical step. What exactly should you ask your doctor? The whole goal here is what doctors call shared decision-making. It's pretty simple, really. You bring your knowledge of your own body and what's important to you. Your doctor brings their medical expertise, and you make the final call together. It's a true partnership.
So, what's the one thing you should walk away with from all of this? If you're taking aspirin for primary prevention, here is the single most important question you can ask your doctor. It's direct, it's based on the latest science, and it gets right to the heart of the matter. Just ask, is the bleeding risk of this aspirin now higher than its benefit for me? That's the conversation that could truly make all the difference.